Morning and welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, March the 3rd. We are joined by our CEO, Nicole Dupuis, and our acting MOH, Dr. Shankar Nasathuri. We will start today's session by going right into questions from our media representatives, starting with any questions from AM 800.
Good morning, Nicole. Just an update in regards to the mass vaccination center. Has the changeover started already?
It will start this weekend. So starting, I believe, on Monday is the day that we'll start doing both our continuing to do COVID vaccinations, but also starting to do those catch-up vaccinations.
Speaking of the COVID vaccinations, just obviously with the numbers that are the reports, the updates that come out daily, and just looking at the summary for the past couple of weeks, individuals receiving their first dose, it looks like we hit a standstill there. Are you still seeing individuals coming in if they're not vaccinated, or basically have you and others thrown in the towel that those 50,000 plus will not be getting vaccinated?
Well, I think that we continue to hope, and perhaps Nicole can supplement my comments, but it is true. I think that we all acknowledge that there's still a significant community of people that are not vaccinated, and we would encourage those people who are not vaccinated to get vaccinated. I remain hopeful that with additional dialogue and continuing dialogue, that people who are reticent about getting vaccinated will make the decision to move forward with it. And we will have continued availability of vaccines through multiple channels, including pharmacies, physicians' offices, community vaccination centers, mobile vaccination sites, school-based vaccine distribution programs. Nicole, perhaps you could supplement my comments.
Yeah, I'll just add, I think when you look at our numbers and our statistics, we're not seeing obviously large numbers of people coming in for our first dose, so it may look like a standstill, but we are still seeing individuals, coming into our clinics and receiving a first dose of the vaccine. So we're still administering first doses, and so for whatever reason, some individuals have waited a little longer, and so we're still hopeful that that will continue, albeit at a much slower pace.
Any idea, and I think we asked this before, but individuals that have one dose and they still haven't, I guess, received their second dose or their booster, any idea how many individuals that is, that basically is that one dose?
Ramsey is on. He may be able to give an accurate number around the number that it still just have one dose. I did get an accurate number that we have about 20 to 40 first doses still occurring every day. I don't have a breakdown on the age, of those individuals. I'm recognizing that children 5 to 11 are still going.
Was the question about how many people have received only one dose and not a second dose?
Yes.
So it's about 13 to 14,000 people, give or take. And that includes anyone who's eligible or who's not yet eligible but could receive a second dose.
Okay, thank you.
Thank you. Any questions from CTV?
Yes, good morning. Do you have any reflections on how the mass vaccination sites went, successes, challenges now that they're winding down?
You want to speak first, Nicole, or do you want me to comment?
Go ahead.
So I think that there are a couple of things that I would observe about the mass vaccination program or sites. One is that it did deliver vaccine to a large group of people in a very short time period. And so it was a vital public health infrastructure. Secondly, it provides, we now have the ability to organize a mass vaccination site if we have to in the future, if there becomes other issues related to the pandemic that require vaccination of large groups of people in a short time frame. Thirdly, I think it highlights the fact that different organizations in the community can work together to organize something that affects the public health and the health of the community. So those would be my initial thoughts about the community vaccination program.
Yeah, I'll just echo and add to what Dr. Nesathuri said. Mass vaccination sites have been incredibly successful. And we've had the longest running mass vaccination site here in Windsor for sure. Just the sheer volume of vaccines that were administered through that site at the height were, close to or a little over 3,000 a day, which is pretty remarkable. I agree. They're incredibly successful. Majority of our vaccines that have been delivered through, within our community or administered in our community have been done so through the mass vaccination clinics, not to take away from primary care contribution or the pharmacy or our mobile clinics, but just given the volume of individuals that can come through the doors and be vaccinated in a short period of time. And as well, I'm glad that Dr. Nesathuri highlighted, but I just from the partnerships and collaboration, it's a huge undertaking, and having municipal volunteers, all walks of the healthcare sector involved in that operation in a coordinated and collaborative way are all just highlights of some of the successes of the mass vaccination sites. Certainly, there are always challenges. There's challenges with everything we do, but I would say that successes far outweigh any challenges that came along the way.
Thank you. And do you expect an increase in hospitalizations or even deaths now that the restrictions are loosened and vaccine passports dropped?
Well, it's always difficult to predict the future, but I do think that it's worth noting that, and the health unit continues to monitor the key metrics of disease burden. I don't think COVID has not been eradicated, and it's not likely to be eradicated in the near future. So I think the public health and health management and the clinical management has to include how to address COVID and COVID-related illnesses moving forward. It's likely that we're going to see other mutations or other variants of COVID in the future, and it's likely that we're going to need a suite of measures to keep COVID under a reasonable management and control. I'm hopeful that we won't have additional hospitalizations and deaths, but I think that only time will tell what these next few months will, what our experience will be over these next few months.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I'm switching gears a little bit here, but I was told that the health unit doesn't have access to the number of people who are experiencing homelessness in the region who have died. The health unit is one of several providers that kind of help to oversee this population, and elsewhere in the province, health units do collect this kind of data to inform policies and practices. So I guess, why does WeCHU not have access to this information, and would it be helpful to track these deaths?
So maybe I'll start. When you say oversee the population, I'm not, the health unit is not responsible for overseeing any specific population. It is an important population within our community as it relates to public health, and certainly within the pandemic as it relates to infectious disease and communicable disease. We don't have access to, deaths in the community are not reported to us. So we do have information. I know we've been reporting as part of our surveillance plan for the COVID-19 pandemic. Communicable disease deaths are reported to us. Those are public health significance. And so those are things that we have routinely provided updates on to the community, but we don't receive, data related to sort of, the every individual death that occurs in the community. I'm sure, Dr. Nesathuri will add, I'm not aware of other health units that do that work other than one. And I believe that a collaboration with their city, actually.
Well, the health status of all people is important to the public health service. And that includes people who are currently experiencing homelessness. Resources of the health unit are spent to advance the health of people who are homeless. And during the pandemic, significant resources have been used to try to help contain the spread of COVID among the homeless community. The way our province is organized is different branches of government are given different mandates. Some of the certain communities and populations, their challenges are divided among multiple agencies. The Public Health Service does have a role at the current time in understanding deaths related to COVID among the community overall. But I think there are multiple agencies that are involved in some of that, and there's likely some variability from county by county on how that work is assigned. Notwithstanding all of that, homelessness is a really serious problem, and it's a problem that is not on the face of it just related to not having a house or not having a place to live. Many people that are homeless experience mental health illnesses. Many of them have been involved with the correctional system. Homelessness has an overlap with people or individuals who might be experiencing substance use disorder, and all of those items require our commitment to try to address the issue. So I think that it's worth us putting a spotlight. And if there's one thing that I could ask is that, as much as COVID has been a burden and a challenge, this is another issue that warrants, I think, further dialogue of the community and a strategy to improve the health status of people that are homeless.
Okay, thank you very much.
We'll move on to a follow-up question from our media outlets. AM 800, do you have a follow-up question?
Just one, Nicole, in regards to the changeover of the mass vaccination site, if someone hears this and they want to go to get a vaccine other than COVID vaccine, do they have to make an appointment, or how does it work?
Yes, for those other vaccinations that we're doing for children and youth, we are working with our school boards to make sure that we can send out information to parents and families that this would be it would be affected by this, as well, obviously working with you, our colleagues in the media, to get information out. But so for COVID vaccine, you can walk in, there won't be any appointments. So whether it's first, second, third dose, anyone can walk in. For all of those other vaccines that will be delivered through the mass vaccination site, there is an appointment booking process for that, and you can go to our website to book those appointments.
And sorry, one final quick one. Is there a timeline on how long these other vaccinations will be offered for?
So they're always offered as far as the, this within the mass vaccination site, they'll be offered as long as it's open.
Yeah, and if I could follow up on that, one of the unrecognized consequences of the pandemic has been that young people have fallen behind on their vaccination schedule. Many of the vaccines that we give in adolescents have benefits into adulthood. And so what we're trying to do with this expanded availability is to try to get young people caught up on their vaccines and be up to date as they begin adulthood or start to enter into adulthood, going off to college or university. And we'd encourage people to avail themselves of this opportunity to bring their children to the vaccination center and get their children caught up.
Yeah, and I'll just maybe add on that point as well. This is something that we, will continue to push forward on through the summer through various channels, including we have some plans to do mobile clinics as well related to this, as we have in the past. And also, we're still working with primary care providers. So if families prefer or want to receive these vaccines that are normally delivered by public health within their with their primary care provider, and they're willing, we're still delivering those vaccines to primary care as well as an option. So as Dr. Nissathuri said, there's a lot of catch up to do, and so there'll be a concerted effort on this for quite some time.
Thank you.
A follow-up question from CTV.
Yes, what do you expect the overall COVID vaccination coverage to be when the vaccine program has wrapped up?
So there's not a wrap up of, if you're asking when the mass vaccination sites close, where we project to be, I'd probably turn to Ramsey to, if he could maybe just give us a highlight of where we think we'll be when the mass vaccination sites close. But we'll continue to deliver COVID vaccine again it'll continue to be available through pharmacies, through primary care, through the public health unit, and I think I mentioned before that our strategy will be more intensive on, again, these mobile and pop-up clinics that we'll bring throughout the community and into neighborhoods. And I think Dr. Nissathuri has spoken in the past that we do expect, potentially, we may have to set up larger sites again in the future for a short period of time to deliver vaccines. So the program isn't wrapped up or over. And we're continuing to try to reach that goal of having everybody up to date on their COVID vaccine.
Yeah, if I could just add, doctors have been vaccinating patients for many, many decades. And that goes way back to the polio vaccine and even before. There will continue to be vaccination programs for a whole variety of diseases and conditions, and so I don't anticipate there will be any conclusion of vaccination as a program in health in Ontario or anywhere else for that matter. With regards to COVID, it's a new disease, and it's likely that we will need to have a system or a mechanism to provide annual or semi-annual or periodic vaccination for people. I think it's to be determined how frequently that might be. One thing we know is that the pandemic has taught us how unpredictable things have been in the past. And I think that moving forward, there may be a time when COVID vaccination is incorporated into the standard group of vaccines that people get at their family physician's office or at their community health center. But in the meantime, until we've really organized a program, I think we need to have the availability of mass vaccination centers or community vaccination centers to deal with the potential immediate demand for vaccine in the future.
Okay, thank you.
And any follow-up questions from CBC?
No, thanks.
All right, everybody, thank you very much for joining us this morning. We will meet again on Monday, March the 7th. Have a wonderful day.
All right, all the best.